Meningitis is a neurological disease condition. Look at this picture, shows that brain and inflammation in meninges. Look at this. CT scan, MRI findings. Look at this to check out swelling and other complications. Detail going on. Introduction. Meningitis is a serious medical condition characterized by the inflammation of the protective membranes, meninges, covering the brain and spinal cord. It can be caused by infections, bacterial, viral, fungal, or parasitic, or non-infectious causes, such as autoimmune diseases or drug reactions. Early diagnosis and treatment are crucial in preventing severe complications and fatalities. Definition. Meningitis is defined as the inflammation of the meninges due to infectious or non-infectious causes, leading to neurological and systemic symptoms. Etymology. The word meningitis originates from the Greek words meninx, meaning membrane, and itis, meaning inflammation, referring to the inflammation of the meninges, the protective membranes surrounding the brain, and the spinal cord. The term was first used in medical literature in the early 19th century as knowledge of infectious diseases and neurology advanced. Types. 1. Bacterial meningitis caused by bacteria such as Neisseria meningitidis, Streptococcus pneumonia, Haemophilus influenza. It is a medical emergency requiring immediate treatment. 2. Viral meningitis, the most common and less severe type, often caused by enterovirus, herpes simplex virus, or mumps virus. 3. Fungal meningitis usually affects immunocompromised individuals, example those with HIV/AIDS, caused by fungi like Cryptococcus neoformans. 4. Parasitic meningitis caused by parasites like Naegleria fowleri, often associated with exposure to contaminated water. 5. Non-infectious meningitis caused by conditions like autoimmune disorders, medications, cancer or brain injury. Causes 1. Bacterial infections, example streptococcus. 2. Viral infections, example herpes simplex virus. 3. Fungal infection, example cryptococcus. 4. Parasitic infections, example Negliero fowleri. 5. Non-infectious causes, autoimmune diseases, certain medications, brain surgery, complications. Risk factors 1. Age, infants and elderly at high risk. 2. Weakened immune system, HIV/AIDS, chemotherapy, organ transplants. 3. Crowded living conditions. 4. Lack of vaccination against meningococcal, pneumococcal infections. 5. Head trauma or neurosurgery. Complications 1. Seizures. 2. Hearing loss or deafness. 3. Cognitive impairment or memory loss. 4. Hydrocephalus, fluid accumulation in the brain. 5. Septicemia, blood infection leads to shock. 6. Paralysis or permanent neurological damage. Pathophysiology, pathophysiology of meningitis, step by step process. 1. Pathogen entry, bacteria, virus, fungi or parasites enter the body through the respiratory tract. Gastrointestinal tract, bloodstream or direct invasion, example skull fractures, neurosurgery. Common bacterial pathogens, Neisseria, meningitis, streptococcus, pneumonia, Haemophilus influenza. 2. Bloodstream inversion, bacteremia, viremia, fungemia. The pathogen multiplies and spread through the bloodstream. Hematogenous spread. Some entry directly through nasal passages or middle ear infections, otitis media. 3. Crossing the blood brain barrier BBB. Pathogens penetrate the normally protective BBB by inflammatory damage to endothelial cells, disrupting tight junctions between cells. Using immune cells as carriers, Trojan horse mechanism. 4. Meningeal inversion and inflammation. Once inside the cerebrospinal fluid, the pathogens multiplies rapidly due to the CSF's low immune defense. The immune system defects the infection and release pro-inflammatory cytokines IL-1, IL-6, TNF alpha. 5. Leukocyte infiltration and increased intracranial pressure ICP. White blood cells, neutrophils in the bacterial meningitis, lymphocytes in viral meningitis migrate to fight the infection. This leads to pus formation, thickening of CSF, and blockage of CSF absorption, increased ICP. 6. Blood brain barriers, disruption and brain swelling. The inflammation causes BBB, permeability to increase, leading to cerebral edema or swelling. This results in reduced oxygen and glucose supply to the brain, contributing to neural damage. 7. Neurological and systemic complications. Increased ICP causes headache, vomiting, altered consciousness, and seizures. Damage to cranial nerves may lead to hearing loss, vision problem, or facial paralysis. In severe cases, brain herniation, coma, or death may occur. Signs and symptoms. A. Early symptoms. 1. Fever and chills. 2. Severe headache. 3. Stiff neck. 4. Sensitivity to light, photophobia. 5. Nausea and vomiting. B. Advanced symptoms. 1. Altered mental status, confusion, drowsiness. 2. Seizures. 3. Rapid breathing. 4. Skin rash. 5. Coma in severe cases. Diagnosis. 1. Lumbar puncture, spinal tap to analyze CSF for infection markers. 2. Blood test and cultures to identify bacterial or viral presence. 3. Imaging CT scan MRI to check for brain swelling or complications. 4. Polymerase chain reaction PCR for detecting viral DNA RNA. 5. Gram stain and CSF culture identifies bacterial or fungal causes. Nursing diagnosis. 1. Acute pain related to meningeal irritation and headache. 2. Risk for infection transmission related to contagious bacterial meningitis. 3. Ineffective cerebral tissue perfusion due to increased intracranial pressure. 4. Altered level of consciousness due to neurological involvement. 5. Hyperthermia related to infectious process and fever. Medical management. 1. Antibiotics for bacterial meningitis. Ceftriaxone, vancomycin. 2. Antiviral drugs for viral meningitis. Acyclovir for herpes induced meningitis. 3. Antifungal drugs for fungal meningitis. Amphotericin B. 4. Corticosteroids reduce brain swelling and inflammation. 5. IV fluids and electrolyte management prevent dehydration and stabilize vitals. Nursing management. 1. Monitor neurological status. 2. Maintain hydration and electrolyte balance. 3. Manage fever, cooling blankets, antipyretics. 4. Administer prescribed medications. 5. Provide a calm, dark environment to reduce stimuli. Treatment options. A. Pharmacological treatment. 1. IV antibiotics. Ceftriaxone, penicillin. 2. Steroids. Dexamethasone. 3. Pain relievers. Acetaminophen. B. Supportive care. 1. Oxygen therapy. 2. IV fluids and nutrition support. 3. seizure precautions. C. Surgical intervention. In severe cases, ventriculostomy to relieve hydrocephalus. D. Rehabilitation therapy. 1. Physiotherapy for neurological recovery. 2. Cognitive therapy for memory loss. Psychosocial medicine. 1. Patient and family education, explaining the condition, treatment, and long term impact. 2. Counseling services, addressing emotional distress and fear. 3. Support groups, connecting with others affected by meningitis. 4. Cognitive and occupational therapy, helping with memory and daily activities post recovery. 5. Financial and social assistance, helping with medical expenses and social reintegration. Prevention. 1. Vaccination, meningococcal, pneumococcal, hip vaccines. 2. Good hygiene practices, hand washing, avoiding close contact with infected persons. 3. Avoiding crowded places, especially during outbreaks. 4. Immune system support, healthy diet, regular exercise, managing chronic conditions. In conclusion, meningitis is a potentially life threatening condition that requires prompt recognition and treatment. While bacterial meningitis is the most dangerous form, viral meningitis is more common and often self limiting. Preventive strategies, including vaccination and hygiene, play a crucial role in reducing the incidence of meningitis. Early diagnosis, timely medical intervention, and comprehensive care can improve patient outcomes and minimize complications. Thank you. Have a nice day.